Okay. All right. Hello, everyone. My name is Meadow, and today I will be presenting on the substance fentanyl, a powerful synthetic opioid that has become a major public health concern. I will be discussing its history, patterns of use, social impacts, and things like that. So I hope you enjoy, and thank you for your time. I'll be discussing what is fentanyl, the history behind it, its social correlates, the trends in use of the substance, along with the media portrayal of the substance, the health effects that are caused by fentanyl, the treatment to reduce addiction to fentanyl and to get away from it, and the laws that are in place against it, what makes it illegal, what makes it legal, how to get prescribed, things of that nature. What is fentanyl? Well, fentanyl is a synthetic opioid that is extremely potent, about 50 to 100 times stronger than morphine. It is legally prescribed for severe pain, especially in cancer patients, but it is also widely produced illegally and sold on the street, often mixed with other drugs. A common situation where an average person can encounter fentanyl unknowingly, which could be purchasing a laced nicotine vaping device or a cannabis device, and we see that a lot in the younger generation these days, buying from sellers, underage people buying from sellers that have laced the products with fentanyl. The history of fentanyl was that it was first developed in the 1960s for medical use as a pain reliever, most commonly in cancer patients, as I mentioned. It became widely used in hospitals due to the effectiveness that it had for curing pain. However, due to addiction, starting in the 2010s, illegal production increased dramatically, which significantly contributed to the opioid crisis in the United States. Fentanyl use affects people across all demographics, but it is often more common in economically disadvantaged communities. Factors such as unemployment, mental health, and the lack of access to healthcare all can increase the risk of opioid misuse. In recent years, fentanyl has become the leading cause of overdose deaths. The number has increased sharply. In 2023, just over 72,000 deaths were due to synthetic opioids in the United States, which makes up 70% of all drug overdoses that year. In the media, fentanyl is often portrayed as extremely dangerous and deadly. It's often shown as addictive, and we see people like struggle with it commonly in shows, social media, and the news. A lot of crime shows it's a common drug to get addicted to. We also see it in some scripted shows such as Euphoria, when the main character Rue was forced to try it in a drug dealer's house, and we see how she kind of goes through the side effects of it. She starts sweating and just like hyperventilating and gets super nervous because she knows how deathly the drug can be, just even the tiniest sliver of an amount. And yeah, so we see how she is dealing with that when she takes it in the show. And that's sort of how we see it in like a realistic but also a scripted way. Um, News coverage also frequently highlights overdose deaths and the growing crisis, as well as social media also playing a role in raising awareness among younger audiences. For the health effects, fentanyl produces strong pain relief and feelings of euphoria, but it also slows breathing, which can quickly lead to overdose and ultimately death. Because it is so potent, even the smallest amount can be fatal. Like I mentioned, just the tiniest sliver, not even as big as in between my fingers, can ultimately lead to death for someone, unfortunately. Um, Naloxone is a life-saving drug that can reverse overdoses, also similar to Narcan. I'm sure many people have heard of Narcan. It's just like a drug that they sell they sell them pretty much anywhere. You can often get them for free at like clinics and stuff like that, where you can it can reverse the effects of an overdose and eventually save someone's life. Treatment for fentanyl addiction often includes medication-assisted treatment, such as methadone or buprenorphine. Prevention efforts focus on education and increasing the access to the treatment. As for the laws that help reduce the harm and reduce the risk of this drug, fentanyl is a controlled substance and it is illegal without a prescription. So that is already set in stone to kind of prevent people to get it, but obviously you can still get your hands on illegal drugs. Unfortunately, that is just the way the world works. So it is illegal without a prescription, and governments are currently working to reduce the distribution illegally. But also, harm reduction strategies are still in place, such as fentanyl test strips and education that goes along with the drug, informing people that may encounter the drug to warn them kind of what it's like, what to expect, how to stay away from it. Those are being used to reduce death caused by fentanyl. In conclusion, fentanyl is a very powerful drug that has contributed significantly to the opioid crisis. While has important medical uses, its illegal distribution has led it to have sort of a negative vibe towards it. The illegal distribution has led to devastating consequences, deaths that no one even could have imagined when it was first created back in the 60s. Um, Addressing this issue really requires a combination of prevention, treatment, and policy efforts, as well as just spreading the word so more people are aware of everything that this drug can cause and how many lives it can take. Thank you for your time, and I hope you all learned something today.